everyone, I'm Sarima Ibrahim and welcome to the first of many bone healthcare series that I'm doing with ALTY, specifically ALTY Surgeons and Specialists. And I'm talking about ALTY Orthopedic Hospital. ALTY stands for Adding Life to Years, and that's exactly what ALTY are trying to do for all of us, which is let us thrive rather than just survive, help us move with ease and comfort, add quality to the life, to the years that we have so we can enjoy our time with our family, with our loved ones, with our friends, and live a long life, not just living, but really enjoying our life to the full. So in these series, I'll be talking to some of the surgeons that work at ALTY. I mean, if you see their list of accolades, it's just amazing, okay? And some of them happen to be my friends, including the first person that I'm going to be interviewing today, who's actually a doctor. Of course, he's a doctor, but he's a specialist, and we're going to get into detail and talk to him in further detail. But let me tell you a little bit about what is provided at ALTY itself. So many people would still remember ALTY, originally named as HSC Medical. It is still the same, and HSC screening is still there, which is an established and comprehensive screening center, but we now know it as ALTY Orthopaedics. And I just wanted to clear that in case you're going to look for it on Instagram, on Facebook, so now you know the name, and actually I'm in the colors of ALTY because I'm going to be working really closely with them. Today, we're going to be talking specifically about joints. So, of course, ALTY takes care of your bones, your spine, your whole musculoskeletal system, which is what pretty much literally keeps us standing and together and put, right? So today we're talking about our joints. Very interesting, especially for someone like me. I'm a mom. I still do a lot of hosting jobs. I have to wear high heels. I'm starting to feel the pain, the wear and tear of life, as not just as a performer, but as a woman. So if you're not going to believe it, if you did not know this, 1 in 6 Malaysians have some form of joint problem that they don't address early. We sort of go like, oh, it's normal, I'm getting old, it'll be fine, it'll sort itself out, put a little bit of ice or put some minyak oil and then it will go away. But unfortunately, it can actually lead to worse conditions such as osteoarthritis, which is a nightmare. And I'm going to talk about this in more detail. So with us today, let me get straight into the person, the expert, the specialist, the doctor, the surgeon himself, Dr. Suresh Siva. Lovely to see you.
Thank you.
We've actually known each other for quite a while, but you've never actually treated me. I mean, I knew you throughout, your professional career, and I would often come to Dr. Suresh and say, I've got these pains and that pains, and he'd say to me, oh my goodness, you need to get checked out. But let me tell you a little bit about Dr. Suresh. I mean, he's got a long list behind his name. You are the consultant orthopedic and arthritis and sports surgeon here at ALTY.
Yep. We're
actually shooting here at ALTY. And you are the first Malaysian doctor honored as the Congress President of SICOT, SICOT. This is the most celebrated International Orthopedic Society in the world. Check this out. So you're the man when it comes down to bones and
joints,
spines and joints and everything. Speaking to Dr. Suresh, I automatically need to sit up straight. I feel like my spine and my bone and my joints are going, show him you're fine. Dr. Suresh's expertise is in total hip replacement, revision hip replacement, and also knee replacement. I'm like, what on earth? You're like building bionic people.
Correct.
You just came from surgery, I believe, doctor.
Yeah, I started at 7 o'clock and it was a anterior hip replacement.
Okay.
And we just finished at about 11.
Is that like a normal day for you? 7 a.m., people come in, you change their hips, next hip, next?
Yes, definitely. 7 a.m. is a usual cut time for orthopedics.
Okay.
Because we like to start early, finish early, and go home and exercise.
You actually go home early? I don't believe it.
We try to go home early.
Okay.
But with the traffic in Jalan Ampang, it's always difficult.
Yeah.
But we do try to go home early. Why do we go home early? Because we want to have a work-life balance.
Yeah.
And we got to exercise. If you tell all the patients to exercise and you don't exercise,
then you're not practicing what you preach, basically.
Yeah. If you see an orthopedic surgeon who's overweight, then
that's not really legit. So we need to come to ALTY to find the proper ones. Okay, can you share a little bit, Dr. Suresh, on how you got into orthopedics and what drove that passion within you? I mean, obviously I know it runs in the family, but for you yourself, What made you want to do this?
Well, the thing about orthopedic surgery that's different from all other branches of medicine is that it's like a combination of engineering and medicine. And it's one of those specialties where you can completely cure the patient. So the patients limp in and leap out. So
really?
That's how it works. Like people come in with knee pain or hip pain and they can't walk, they got deformity, and then you replace the joint and then they're running home.
And so you're adding life to their years,
Yeah,
basically.
exactly,
I mean, really figuratively speaking.
So the passion is both joint replacements and sports medicine. And there's huge amounts of athletes, weekend warriors, people who play sports at the weekends.
Right.
All these people need help.
Yeah, okay, so your general Malaysian though, you know, I was just saying earlier, 1 in 6 Malaysians, 31% have some sort of symptom at least of having osteoarthritis. So what does that mean? What do you see in Malaysia in our context?
Well, the knee is the commonest joint that is affected.
Okay, and it's the
biggest joint.
I did not know this.
Yeah.
The knee is actually the biggest joint.
It is.
Not the hips.
Yeah.
What is that?
Yeah, the knee is the biggest joint.
Okay.
And that's common in Malaysia because a lot of Malaysians squat down and they put a lot of wear.
Why are we squatting so much?
I don't know.
What are we doing?
So when I was working in the US and the UK, hip arthritis was more common.
Because they are doing what more?
It's more genetic. The hip is more common. And you know, if you go to the West, knee arthritis is less common than hip arthritis.
Okay, now there's two things I got from that. So is it genetics? And when you talk about going to the West, I'd like to know about the weather and how that impacts. So when you say that, you know, they suffer more from the knee. So I mean, what's the difference? Does weather play an important factor?
Absolutely, yeah. The weather is different. It's colder in the US.
And that actually affects your joints?
Yeah, absolutely. So if you have arthritis and you go up to Cameron Highlands, it gets worse.
You feel it more?
Yeah.
Why is that, doctor?
Because it's to do with the change in atmospheric pressure, and also the cold makes the joints more stiff.
I see.
And when you go into an aeroplane, and you have
Yes.
knee arthritis, the pain gets worse because, you know, one theory is that there are fluid in the subchondral bone in the knee, and when you go up in the airplane, this fluid expands and pushes against the bone,
So
the
that
wall.
causes the
That
pain.
causes pain. So a lot of arthritis sufferers, when they go to a cold country, they feel worse. But when they come to warm country, they feel better. Yeah.
So that's why a lot of people are moving over here.
Correct.
And moving Southeast Asia.
And that's why a lot of older people in the UK or US, they retire to warm countries.
Yeah, and they love the summer.
Like the south of Spain or whatever.
Okay.
Yeah.
So does that mean like for somebody like, you know, who's suffering from sort of the beginnings of arthritis, they should not have the aircon on or, you know, keep the temperature of the rooms warmer?
Correct. And also it's very important if you have symptoms like pain, you should see a doctor.
Yeah, of course.
Yeah, because you know what we say, prevention is the best cure.
It is.
Yeah, because don't wait till it's too bad and you can't do anything
But
about it.
that's humans, and we love to wait till things are too bad. But going back to the genetics that I mentioned earlier, is it a genetical issue? Is it something that's passed on? Like if my mother and father have something wrong with their hip or knee or their joints, I will also get it, or is it an environmental thing?
There is definitely a genetic component.
Oh, so there is, okay.
And it can affect people in the same family, go down the family tree, but there is also an environmental component. So if you're a manual laborer, heavy working person, lifting heavy weights, climbing lots of stairs, you know, running marathons, playing lots of soccer.
You've run a marathon.
I have,
You ran the London Marathon.
Yeah, once.
So
then I realized, you know, that's not good for your knees.
Okay, did you have problems after that?
Well, no. I think once is okay, but
Okay,
just to get the medal.
But not like all the time,
medal,
right?
but not all the time. You know, runners really got to be careful. If you're a runner, you got to make sure you have good shoes. Try to run on grass rather than solid surfaces, tarmac, you know, and these kinds of things. You know, I had a friend who was an ultra marathoner, and he would run like 30, 40 miles a day.
Oh my goodness.
And you know, his knees were
gone.
Destroyed.
Did you do surgery for him?
Well, he's an orthopedic surgeon himself.
Did he do it for himself?
No, he didn't. But
Can you do it for yourself?
No, that would be tough. There was about 200 years ago, there was a surgeon called Percival Pott, who his horse kicked him.
Okay.
And it was in 1884, I believe. And he wanted to watch his own surgery.
No.
Yeah, so
In the 19th century,
In the
how did
ni-
he manage to do that?
so he said, no worry, I'll stay awake and watch it. And then he made the surgeon like cut his leg while he was watching it. It didn't end well. I think that's how he died.
I don't think it would have ended
Yeah.
well back
So-
in 18 something. Okay,
so I
so we
think-
don't want to be doing that.
Don't want to be
Yeah,
doing
just
that.
a disclaimer, do not do surgery on yourself. Come to Alti and get it properly diagnosed and
Yes.
meet the actual surgeons.
Yes.
Okay, so some of the signs, Dr. Suresh, of joint problems. Okay,
Right.
like for me, for example, I've been doing sports. A lot of our viewers are either students, they're postures, or people who are at work at the office all day. Speaking of students, what do you think of the whole like backpack carrying heavy school
Yeah,
books?
that's
Does this
insane.
actually impact the joints?
Absolutely. I think you should not overload the students. There should
Okay.
be a weight limit and make sure they don't carry heavy books.
So like before you go to class, there's like a weighing machine like before you're bored, and you
Yeah.
do not carry any heavier
Yeah,
than
because
that.
all these little kids carrying heavy bags can't be good for them.
Okay.
Yeah,
And
yeah.
posture, does posture make a difference, doctor? Like, I
Absolutely.
mean, how you sit generally
Yeah.
every day?
Try not to slouch, try
Okay.
not to sit forward. We're all guilty of it. But when you're conscious of yourself doing it, try to sit up, you know? That's
Because
I
what
do.
happens? I mean, that doesn't give you arthritis, obviously, if you're slouching, but what will it do to your joints?
Well, it puts the muscles under a lot of strain.
Okay.
And when your muscles get tired, then the weight, they can't carry the weight of your neck and your head, and it goes down your spine, and it can give you arthritis or degenerative changes in your spinal bones.
It can give you arthritis. Now, this is interesting to me when you say that it can give you. So, arthritis, am I correct to say it is the actual disease, but it also sounds the way you word it like a symptom? It's almost like arthritis is what you get as a result of an injury
Yeah.
to the actual
So that's
system.
post-traumatic arthritis, and post-traumatic arthritis is after you have an accident or an injury.
Okay.
That can cause arthritis, or poor posture, not taking care of your back, a lot of micro injuries, micro
Yeah.
trauma, all those kinds of things can cause degenerative changes. Of course, there's a balance between genetics and environment, but
Yeah.
if you're in a very harsh environment and
Okay.
you're not taking care of yourself,
Yeah.
you can get arthritis.
And you can even get like issues like bunions. Are bunions a bone or a joint issue, doctor?
Well, it's a joint.
Okay.
And basically your first big toe is gone inwards, and that's called a bunion, and it's really painful for some people.
It is extremely painful, especially for ladies, all the ladies out there, and maybe some men wearing high heels.
Yeah.
Bunions are no joke. And you can do surgery here at Alti to sort out bunions, of
Yeah,
course.
obviously, I mean, with bunions, if you come early, you
Yeah.
can have a non-operative treatment like a shoe wedge or something to push the toe out.
Yeah.
But if it's too far,
late.
if it's too late, then you need a surgery to correct the angulation and make it straight again.
You know, we're going to talk in more detail about surgery and all that, but I've got a few more questions. Gout, okay? I've got two friends of mine who have gout at the moment, and I thought gout was purely because of diet alone. Can you explain a little bit about gout and how it's linked to joint and bone health, etc.?
Yeah, so gout is basically the buildup of uric acid crystals.
Okay.
And it can be very painful when you have a lot of these crystals in your joint.
And how do these crystals come about? How do they get there?
So basically, it's when you overconsumption of red meat, overconsumption of red wine,
Okay.
cheese.
All right.
These are foods which have high uric acid concentration. So this means the uric acid is not shed out through the urine
Properly,
yeah,
okay.
it builds up in the joints. Of course, there's a genetic component as
Yeah,
well.
okay.
And the most common joints that are affected are the big toe, a lot
Yeah,
of
you
pain,
see a lot of people
Yeah.
wearing that when they've got gout.
and then ankle, knee, and also sometimes your hand and your thumb. So it can be very swollen, hot, and painful.
So it is linked to diet as well. So in
Yeah.
order to take care of our joints, obviously, it's not just the movement aspect of things, it's also the nutritional aspect of
Correct.
taking care of your joints. So
Correct.
are you saying, but you see, the thing is some people who eat a high diet in meat, etc., don't get gout.
Correct.
So again, what does it come down to? Is it accumulation of many, many things that result in a problem, or is it for sure you're going to get it?
I think the answer to that question, it's multifactorial. So many different factors, but diet is definitely one of it, exercise, and genetics. One thing we really want to talk about here in Alti is longevity. You know,
Okay.
all of us are going to live to 100 because,
We hope.
because of the advances in science and technology
Yeah.
and food. And we have this thing coming, and the scientists call it a silver tsunami.
Okay.
So that means like in 10 years, the number of people over 65 will be more than the number of people under 20.
So we have a huge demographic of older people. And that is negative or positive in terms of?
Yeah, you can make it a positive thing or you can make it a negative thing. So a lot of governments and a lot of NGOs are actually going to try to make people add life to their years so that they can live longer, but not just living longer, but contributing and working and thriving. Like some countries have increased the retirement age to 70, for example, so that the people can go to work and contribute. So that's something that we want to help people with in ALTI, because if their bones and joints are working well, they don't have aches and pains, they can go to work.
They can be more productive members of society.
They can go for work, they can go for holiday, vacation. So that's one really big thing that we are aware of. It's called the silver tsunami.
The silver tsunami. So we want to, again, as you just mentioned, Dr. Suresh, that's why ALTI is working hard to help society, not just Malaysians, international patients too that come by, to seek out diagnosis and treatment. It's not all surgical, okay? There's also non-surgical, and we're going to get into that later. So before we go for a break, before we check out the video and go into the Q&As that we have from the audience, can you just explain to us what these are? Because often you see shows and there's props, and then people are like, what is that? It's just there for what, you know? So can I hold this?
Absolutely.
Okay, so this is, it says here, a healthy, moderate, severe, and implant. This is your hip, obviously.
Correct.
So this is your socket, this is the ball, and this is where it fits in.
Yeah, so let me go through it real quick. Can you see it? Yeah. So if you look at this, this is a normal hip replacement. A normal hip, it's nice and wide.
This one here.
You can see the synovial, the cartilage, really nice, good cartilage, no damage. Now, if you look at a moderately damaged hip, you can see it's slightly breaking down. There's some bleeding in here.
That's bleeding within the actual cartilage?
Yeah, subchondral bone. You can see some lack of cartilage.
So this is a normal person, say a young person, and then this is person who's what? Like been wearing heels way too long, been
like
running marathons.
In his 50s or 60s. And then here is a really bad one, and look here.
Oh.
It's completely destroyed, and you can see that
it's in the bone itself.
It's in the bone, it's completely destroyed, deformed. And someone with a hip like this is going to have a lot of pain, a lot of disability. They won't be able to walk, and they won't be able to enjoy their life. So what we do here in ALTI is we replace this hip with a ceramic head, a little stem that goes down the canal of your bone, and a little socket. And this is what we call a total hip replacement. Now, ALTI is the only hospital in Malaysia that has a special table called a HANA table that allows us to position your hip accurately for the direct anterior hip replacement that we
The HANA table.
Yeah, H-A-N-A. HANA.
Who's HANA?
I don't know who it's named after, but
maybe the first person who sat on the table, perhaps.
No, I think the HANA table was developed with the guy called Joe Amata in the U.S. And it positions the hip very accurately so that you can put a hip replacement in through the front. That's what I was doing this morning. I was doing a direct anterior hip replacement.
You put one of these in somebody's hip.
This morning with a direct anterior approach and a HANA table and a new type of hip replacement called a MDM hip.
MDM hip.
MDM hip.
Okay.
It's a dual mobility hip.
Okay.
So most hips have one ball and one socket, and that's how it works, right? But a dual mobility hip has a little ball and a bigger ball and a socket. So it has 3 articulations.
It's like upgraded iOS of hip replacement.
It's more stable. You can do more activities. You can have a better range of motion. So this particular patient actually came from Indonesia, and he looked for us here in ALTI. And as soon as I saw him, the first thing he said was, I want a dual mobility hip.
He knew what he wanted.
He'd done his research. He went everywhere asking for dual mobility hip and direct anterior approach and HANA table. And everyone said, no, we just do the standard one. We don't have this, you know.
Except for ALTI.
Except for ALTI. So he came here and we were like, oh yeah, that's what we do every day. So he was able to have a dual mobility hip, direct anterior approach, and Hana table. So
In
very
Malaysia.
happy. In Malaysia. He didn't have to go to US or UK.
See, this is the beauty of knowing what we can provide to Malaysians and to international patients. We have it all here. I mean, just come by one day and check out Alti Orthopedic Hospital. It's just so, it's like top of the line. It's wonderful. We'll talk more about that in depth after this. I've got a question from our social media, and it came from Aimi Abdullah from Shah Alam, and she posted earlier. She said, how can I convince my parents that it is a safe procedure, like joint replacement? You know, a lot of older people are scared. They just go for the injections. They don't want to, you know, get knocked out, for example, Dr. Suresh. So, you know, I mean, you can say, because you do it all the time, it's fine, you know, it'll be okay. But for us normal people, it sounds pretty scary, because I'm looking at my hip here and it feels really big, and my knee, and I can't imagine somebody, you know, going in there at it, you know?
Yeah,
Should I be scared?
Traditionally, hip and knee replacement surgery have had long hospital stays in the beginning. That was like 30, 40 years ago.
Okay.
Now, it's a 1 day or 2 nights, 1 or 2 night stay in hospital.
Wow.
So now, it's a 1 or 2 night stay in hospital. So you come in, you get your hip replacement or knee replacement done in the morning, then you walk around and you go home the next day.
How is that possible?
Okay.
I mean, what's the big difference? Is it in what you use?
Right.
Or is it in the Hana table? Or what's causing this speed up recovery aspect of it?
Well, we have now what we call ERAS, or Enhanced Recovery After Surgery.
We're going to talk about that later on.
We are. And there's these components which deal with anesthetics, with incision, with aftercare, that allows patients to go back more quickly. So now hip and knee replacement has become like a cataract, where it's done on the same day. In fact, in the United States, the top 3 most successful surgeries are cataract, hip replacement, and knee replacement.
Wow, it's so normal.
It's so normal.
So Amy, you know, you can tell your parents that, you know, they can get such services here at Alti Orthopedic Hospital. There's nothing to be afraid of.
Yeah.
And, you know, share this with them. Perhaps they'd like to watch this video and learn a bit more in depth.
The other thing to tell your parents is that the alternative to having a surgery is to take painkillers and to take injections. The painkillers and the injections have side effects. A lot of these side effects can cause gastric bleeding, it can cause infection. So the alternative is to continue with painkillers, which have got risks.
Yes, okay. So basically, we've got to look at short-term versus long-term.
Correct.
And for your parents, and if they want that quality of life, Alti adding life to your years, you know, you've got to look at the bigger picture.